Hello, I'm Jen, and I'm a student nurse here at Southwest Tech. How are you today?
Good.
Good. I'm going to be doing some injections today for you. Is that okay?
Yeah.
Can you give me your name and date of birth?
Tiana Kelly, 3/16/97.
And do you have any allergies?
Sofa.
Okay, and I'm checking that on your doctor's orders here, and your name is this person I'm supposed to be doing it on. Okay, and I'm going to be using gloves for this. I'm going to be doing the tuberculosis first on you, and I'm going to check my doctor's order to my MAR to make sure that's what I'm giving you. So I'm going to be giving you tuberculin 0.1 mLs, tuberculin 0.1 mLs, and that matches up. I'm going to look at my vial here, and it says tuberculin 0.1 mLs, and it's not out of date, so that's good. And the integrity of the bottle is good, so that's all good there. So the first thing I'm going to do is disinfect my vial, and I would do this for 30 seconds, which I'm not going to for the sake of the video. And then I'm going to clean my spot, and this will be on your inner arm. So I could clean this for 30 seconds as well. Do that for the sake of the video. Okay, and then I'm going to open my needle. And I'm going to get the air, 0.1, put it in my bottom, lift it up, and I'm going to draw the 0.1, and I'm going to do my first check, and I make sure it's tuberculin 0.1 mLs, and it's 0.1 mLs. Get the air bubbles out of there. And then I would do my other check, tuberculin 0.1 mLs, 0.1 mLs, check it on my MAR, tuberculin 0.1 mL. And then I'm going to do and then I'm going to explain what the tuberculin is. The action of it is a test for tuberculosis. Some side effects, you would have redness, fever, rash, shortness of breath. So if you have any of those, you'd have to come back in and tell us and see us. Some serious side effects is anaphylaxis, and that is an allergic reaction to it. So when we give this to you and it blebs up, so the skin will raise up, that's good. And if it doesn't, then it's not good. It's not working. Okay, and then I'm going to do my third check. So tuberculin 0.1 mLs, 0.1 mLs, and then I check it to my MAR, tuberculous 0.1 mLs. And I'm going to say my 5 rights. So the right patient, right route, right time, right dose, and right, okay. And the last one is right med. So then I would put up the vial. All right. So then I would have this angle at is it 45 degree? 90. Oh, now for this one I don't do that. So I just have it like, what is that called?
Bevel.
Oh yes, the bevel. I would have my bevel faced upward while I'm inserting it in. And I don't have to stick it all the way in, and then I would do it to get my leb and my hot dog split. So and then I would pull out. And for this, when I'm done, I would put a safety lock on it, and then I would put it in my sharps container. Okay. And then I would ask you if there's anything else I can do for you today.
No.
All right, and then I would document. Ready? All right. Next, I'm going to be, I'd wash my hands again. I put my gloves on. And next I'm going to be giving you Novolog, and I'm going to check my doctor's orders to make sure that that is on here and Novolog is on there. So, and I already had checked your blood sugar, and you were at 318, so I'm going to be giving you 10 units of Novolog. Okay, so now I'm going to check my vial, and the integrity of my vial is good. It's not out of date, and it says Novolog, and I will be giving you 10 ml or 10 units, and I'm going to check it with my doctor's orders, and it's Novolog, and I'm giving you 10 units. And checking my MAR as well. So that says I'm going to be giving you Novolog. I'm going to be giving you 10 units because you were at 318. So now I'm going to clean my vial. And I would do this for 30 seconds, again, for the sake of the video. And then I'm going to clean the spot that I would be giving it to you on your stomach. And you're going to have it 2 inches away from the belly button. So I clean that area. And again. Okay, so then after that, I would, giving it to the spots that I would be giving it to you in would be your lower stomach. I would give it to you in the back of your arm and your inner thigh. I would give it to you, and like I said, the lower part of your stomach. So those are the places that I can give it to you, but I'm going to be using your stomach. And also, being that you're a pretty fit person, I would go at a 45-degree angle, but if you're a bigger person, I would do a 90-degree angle, and I would be pinching your skin as I am doing it. The action of this Novolog is it's supposed to lower your glucose, your blood glucose. Some side effects is hypokalemia and swelling. And some serious side effects is hypoglycemia and anaphylaxis, and that's like an allergic reaction to it. And the hypoglycemia is to lower the level of your electrolyte and potassium. All right, and this is a high alert drug. All right, and then I would check my vial to my MAR again, and it says the Novolog, and I'd be giving you 10 units. 10 units, and that's what Mar said, and then I'll put my needle. All right, and I'm going to draw back 10 units that I'm supposed to, and then I'll check it against the MAR, and I'm giving Novolog 10 units, and my MAR says Novolog 10 units, and then I would do it again. Novolog, 10 units, and to the MAR, and then I'm going to say my 5 rights. Before I do my 5 rights, I'm going to have my other little nurse assistant come and check my vial and what I drew up against my MAR.
Okay. On here. And then there. Good.
All right. And then I'm going to do my 5 rights, and that's right patient, right time, right route, right med, and right dosage. Okay, and then I'm going to check my med against the MAR again, and Novolog, I'm giving 10 mLs, Novolog 10 mLs. Okay, and then, like I said before, I would make sure I'm 2 inches away, I would pinch the skin, and this I'm going to do the 45-degree angle. And then I would push it all the way in. And I would just do this over 10 seconds. So I would count to 10. And then I would leave it in there for 10 seconds to make sure all the med gets in there and that it doesn't come back out. And then I would pull out. And then I would lock my needle. I would discard it in the sharps container. And I would ask you if there's anything else I can do for you.
Nope.
All right. All right, the next thing I'm going to be doing is giving you Demerol. And I wash my hands again. And I'm going to use gloves again. I'm going to check my doctor's orders and make sure that I have the same as my MAR and on my bottle. And I have, hold on, I have Demerol, 100 milligrams IM, and I can give this every 4 hours, PRN for pain. So I would ask you what your pain is.
8.
All right, and you had this 6 hours ago, so I can give you this pain med. Yes, because it's in the 4-hour window. And then I'm going to check that against my MAR, and I see that it is Demerol, 100 milligrams IM. I can give it to you every 4 hours, and your pain you said was 8, so that looks good. Then I would look at my vial, and it says Demerol, 100 milligrams every 4 hours for pain, PRN. And the date is good, and the integrity of the bottle is intact, so there's nothing wrong with that. And then next thing I'm going to do is, for the needle, I'm going to use a 22 gauge by 1.5 inch needle. And I'm going to use this because you're a pretty good shape person and you're not bigger. So we have sites that are smaller and bigger. So I'm going to be using that. So I'm going to clean my vial. And I would do this for 30 seconds, but for the sake of the video, I will not be doing that. And then I'm going to tell you the locations of the parts that you can give this in, and there's 3 different sites that you can give it. The first one is going to be the deltoid, so it's kind of backwards here, but normally your little finger would be up here and your thumb would be down there, so I'm backwards. But then in between the big finger, I'm trying to think. Okay, I forgot to mention that you would have your 4 fingers, 1, 2, 3, 4, and then I would give it below my little finger because my thumb would be down there, so I'd give it in this area. And then my next one would be the vastus lateralis. Oh, is that the iliac crest and the spine? So okay, this is the vastus gluteus. Sorry, I mixed that one up. So then I would find the hard part here, and I would have my fingers on where the iliac spine is, and this one would be going towards the iliac crest. And I would move I'd move my finger like this, and then I would give it right in this area here on your iliac crest. And then my other one is the lateralis that I was going to say, and that'd be on the side. Well, I guess I can kind of do it here. It'd be on the side, so I'd put my hand here, and I would find. All right, you don't do it this way. I would find my trochlear. I'd put my hand here. I'd put my other one on my knee here. And then in between here would be the 3 sections, and I would do it into the middle part of that area. So those are my 3 sites. Then I'm going, so in the deltoid site, I would give 1 milliliters in that one, and in the vastus lateralis and the ventral gluteus, I would give 3 mLs in those areas. All right, so then I'm going to clean my area, if it'll stay. So I clean it up here. And I would do this for 30 seconds as well. I'm gonna have to lay it down for a second. Okay, and then I would take this one off and put it on my sterile. Put it back in there, because I'll use that after. And this one's to draw up. Screw that on. Hook this into my vial. Lift it up. Then I'm giving 2 mLs of this. So I draw this up to 2. Make sure there's no bubbles. And then I'm going to check it to my MAR. So I'm giving Novolog 2 mLs, and on my MAR, sorry, I'm giving Demerol, not Novolog, I already did that one. So I have Demerol, and I'm giving 2 mLs, and then on here it says Demerol, and I'm giving 2 mLs. And then I'm going to do cite my 5 rights. So right patient, right med, right route, right time, and right dosage. Okay, and then I'm going to do my 3rd check. And so I have, my 2nd check, and then I'm going to do Demerol, 2 mLs, and I'm checking my vial, and then to my MAR, Demerol, 2 mLs. And then I would ask my person, so if she could look at this for me.
Okay, check your MAR, and then check your syringe. Good.
All right. And I'm just going to check it one more time. So I do Demerol, 2 mLs, Demerol, 2 mLs. Okay. Then I would put my cap back on. And I'd take this one off, and I would get my needle. Okay. Now my site is clean. If I touched it, I would clean it again. So I find my spot here. And then I would do a 90-degree angle, then Z-track it.
Okay.
Okay, I'm going to find my spot. I would do a 90-degree angle, but first I would Z-track it. And then I would hold it, and then I would do the 90-degree angle and put it in. And it won't let me go all the way down. And then I would do this over 10 seconds. And so I would count while I'm giving this. Okay, and then I would hold it there just for 10 seconds. And then I would pull out, and then I would put my gauze on here, and I would put some pressure on it just for a few minutes. And then I would lock my needle. Okay, so I lock my needle, and then I would put it in the disposable area. And then I would ask you if there's anything else I can do for you today. And I would document and take off my gloves and wash my hands.